Cancer. It's a word that can stop conversations, change lives, and fill hearts with fear. For many people, hearing the word cancer immediately brings thoughts of suffering, uncertainty, and loss. It is one of the most talked about diseases in the world, yet it is also one of the most misunderstood. Some people believe cancer is a death sentence. Some believe it only affects older people. Some think cancer cannot be prevented. Others assume that if they feel healthy, they don't need to worry about it. But the truth is far more complex and, in many ways, far more hopeful. Today, millions of people around the world are living healthy, fulfilling lives after surviving cancer. Medical science has made extraordinary progress. Many forms of cancer can be treated successfully, and some can even be prevented. Knowledge is one of the most powerful weapons against this disease. The purpose of this discussion is not to create fear. The purpose is to educate, empower, and encourage. Because when people understand cancer, they are more likely to recognize warning signs early, seek medical help sooner, make healthier choices, and support those who are facing this difficult journey. So, settle in and join me as we take a deep and compassionate journey into understanding everything you need to know about cancer. The human body is made up of trillions of cells. These cells are the building blocks of life. Every day, cells grow, divide, and die in a highly organized process. Think of your body as a perfectly managed city. Every cell has a job. Every cell follows rules. Every cell knows when to grow and when to stop. Cancer begins when some cells stop following these rules. Instead of growing in an organized way, these cells begin multiplying uncontrollably. They ignore the body's signals to stop. They refuse to die when they should. Over time, these abnormal cells can form masses called tumors. Some tumors remain in one place. Others invade nearby tissues and spread to distant parts of the body. This spreading process is called metastasis. Metastasis is what makes many cancers particularly dangerous. Cancer is not just one disease. It is actually a group of more than 100 different diseases. Each type behaves differently. Each type has its own causes, symptoms, and treatments. Cancer is not a modern disease. Evidence of cancer has been found in ancient Egyptian mummies. Ancient physicians documented tumors thousands of years ago. For centuries, people had little understanding of what caused cancer. Some believed it was punishment from the gods. Others thought it was contagious. Some even believed it was caused by evil spirits. Modern medicine has changed everything. Scientists now understand that cancer develops because of changes inside our cells. Research continues to unlock new discoveries every year. The fight against cancer has become one of humanity's greatest scientific challenges. At the center of every cell is DNA. DNA contains instructions that tell cells how to behave. Sometimes these instructions become damaged. This damage is called a mutation. Mutations can happen because of smoking, radiation, certain chemicals, viruses, aging, inherited genes. Sometimes mutations occur randomly. Most damaged cells repair themselves or die. But occasionally, damaged cells survive and continue multiplying. Over time, these cells become cancerous. Cancer often develops slowly. Some cancers may take years or even decades before symptoms appear. This is one reason regular health checkups are so important. The different types of cancer. Carcinoma. This is the most common type of cancer. It begins in the skin or tissues lining organs. Examples include breast cancer, lung cancer, colon cancer, prostate cancer, sarcoma. This type begins in connective tissues such as bones, muscles, fat, blood vessels. Leukemia. This is cancer of the blood-forming tissues. Instead of forming tumors, abnormal blood cells grow inside the bone marrow and bloodstream. Lymphoma. This affects the immune system. It begins in the lymphatic system. Multiple myeloma. This cancer affects plasma cells, which are part of the immune system. The most common cancers in the world. Breast cancer. The most common cancer among women, although men can also develop breast cancer. Lung cancer. One of the deadliest cancers worldwide. Strongly linked to smoking but can also occur in non-smokers. Prostate cancer. One of the most common cancers in men. Many cases grow slowly. Colorectal cancer. Affects the colon or rectum. Often begins as small growths called polyps. Cervical cancer. A highly preventable cancer thanks to screening and vaccination. Liver cancer. Often associated with hepatitis infections and liver disease. Skin cancer. Frequently linked to excessive sun exposure. What causes cancer? Cancer usually develops because of a combination of factors. Smoking. Tobacco contains thousands of harmful chemicals. Smoking damages nearly every organ. It is responsible for millions of cancer deaths worldwide. Alcohol. Heavy alcohol use increases the risk of several cancers. Obesity. Excess body weight can contribute to many forms of cancer. Poor diet. A diet lacking fruits and vegetables may increase risk. Physical inactivity. Exercise helps regulate hormones and strengthen the immune system. Radiation. Excessive exposure to certain types of radiation can damage DNA. Infections. Some viruses and bacteria increase cancer risk. Examples include human papillomavirus, hepatitis B, hepatitis C. Genetics. Some people inherit genes that increase their risk. Having a family history does not guarantee cancer will develop. It simply means extra vigilance may be necessary. Early warning signs of cancer. Cancer symptoms vary widely. However, there are warning signs everyone should know. Unexplained weight loss, extreme fatigue, persistent pain, a lump or swelling, changes in skin appearance, difficulty swallowing, persistent cough, changes in bowel habits, blood in urine or stool, night sweats, frequent infections. The presence of symptoms does not automatically mean cancer, but persistent symptoms deserve medical attention. How cancer spreads. Cancer can spread through the bloodstream, the lymphatic system, direct invasion into nearby tissues. When cancer spreads, it is still named after where it started. For example, breast cancer that spreads to the bones is still breast cancer. How doctors diagnose cancer. Diagnosis often begins with medical history, physical examination, blood tests, imaging tests, CT scans, MRI scans, PET scans, ultrasound. The most important test is usually a biopsy. A biopsy involves removing tissue to determine whether cancer cells are present. Stages of cancer. Stage 1, small and localized. Stage 2, larger but limited. Stage 3, spread to nearby lymph nodes. Stage 4, spread to distant organs. Earlier stages generally have better outcomes. Cancer treatments. Surgery, removing the tumor. Chemotherapy, using medicines to destroy cancer cells. Radiation therapy, using high-energy rays to kill cancer cells. Immunotherapy, helping the immune system fight cancer. Targeted therapy, attacking specific weaknesses inside cancer cells. Hormone therapy, used for certain cancers that depend on hormones. Bone marrow transplant, replacing damaged blood-forming cells. Side effects of treatment. Fatigue, hair loss, nausea, weight changes, pain, memory problems, emotional stress. Many side effects can be managed successfully. The emotional impact of cancer. Cancer affects more than the body. It affects the mind and spirit. Many people experience fear, anxiety, depression, loneliness, uncertainty. Emotional support is an essential part of treatment. How cancer affects families. Families often become caregivers. They may experience stress, financial pressure, emotional exhaustion, fear of losing a loved one. Support systems matter enormously. Can cancer be prevented? Not all cancers can be prevented. However, many cases may be reduced through avoiding tobacco, maintaining a healthy weight, exercising, eating nutritious foods, limiting alcohol, protecting against infections, regular screenings, vaccinations. The importance of screening. Screening can find cancer before symptoms appear. Examples include mammograms, pap tests, colon cancer screening, prostate screening discussions. Early detection saves lives. Living with cancer. Many people continue working, raising families, and pursuing dreams while undergoing treatment. Cancer changes life, but it does not define a person's worth, identity, or future. Cancer survivorship. Millions of survivors around the world demonstrate that hope is real. Life after cancer often brings a deeper appreciation for life, stronger relationships, renewed purpose, greater resilience. Cancer is one of humanity's greatest health challenges, but it is also a story of courage, a story of science, a story of resilience, a story of hope. Every day, researchers are making discoveries. Every day, doctors save lives. Every day, families stand together. Every day, survivors prove that cancer is not always the end of the story. If there is one message to remember, let it be this. Pay attention to your body. Seek medical advice when something feels wrong. Take care of your health. Support those who are fighting. And never underestimate the power of hope, because knowledge can save lives. Early detection can save lives. Compassion can save lives. And sometimes, a single conversation about cancer can change someone's future forever. Thank you for listening, and may this knowledge inspire you to care for your health, encourage others, and spread awareness that could one day save a life. If today's discussion has taught you something new, inspired you, or helped you better understand cancer, don't keep this information to yourself. Share this video with your family, your friends, and your loved ones. You never know whose life could be changed, or even saved, by the information you've heard today. Remember, knowledge is power and awareness saves lives. And this is only the beginning. In our next episode, we'll dive even deeper into important health topics, uncover more life-changing information, and provide practical tips that can help you and your loved ones live healthier, happier, and longer lives. So don't miss out. Subscribe to Health. Take care of your body, protect your health, cherish your loved ones, and remember, your health is your greatest wealth, and every small step you take today can create a healthier tomorrow. This is Health.